On the Healthline Nevis News and Reviews Roundup, brought to you courtesy of the Health Promotion Unit in association with Evelyn's Drugstore. Hello and welcome to this week's edition of On the Healthline News, Reviews and Updates. I'm Sheila James, your presenter. In today's news package, Nevis Health, Police and Fire participate in an emergency medical response workshop. Update on STEPS programme on Nevis, and 2020 Biennial Work Plan BWP planning mission with the Ministry of Health officials, St Kitts and Nevis. We take up these stories after this short break.
It's flu season. Protect others from getting sick. When coughing and sneezing, cover mouth and nose with flexed elbow or tissue. Throw tissue into closed bin immediately after use. Clean hands with alcohol-based hand rub or soap and water after coughing or sneezing and when caring for the sick. Protect yourself and others from getting sick. Wash your hands after coughing or sneezing, when caring for the sick, before, during and after you prepare food, before eating, after toilet use, when hands are visibly dirty, after handling animals or animal waste. This message was brought to you by the Nevis Health Promotion Unit.
Welcome back. On Monday, the 10th of February 2020, health practitioners, EMTs, police and fire professionals took part in an intensive training in emergency medical response workshop held at the Nevis Disaster Management Department. Facilitators were Dr. Ben Usash, a medical doctor specialising in emergency medical in Pennsylvania. He's also a professor at the University of Colorado. His team comprised of Mr. Christopher B. Flanagan, a police with Radnor Police Force. He's also Chief of Operations for Narbeth Ambulance Service. Mrs. Anne Hiley-Gergel, nurse and paramedic of the Narbeth Ambulance Service, and coordinator responsible for the workshop, Mrs. Roxanne Brooks. Dr. Paul Rawlins, Acting Chief of Staff at the Alexandra Hospital, spoke to On the Healthline about the importance of the workshop.
I am Dr. Bal Rawlins, Surgeon and Acting Chief of Staff of the Alexandra Hospital. Today we're here as part of a collaborative effort between the Four Seasons Villa Owners Association, the Nevis branch of the St. Kitts and Nevis Red Cross, and the Ministry of Health. What we have is that we have some facilitators from the United States who came here, sponsored by the Villa Owners Association at Four Seasons, and they're doing some first responder training and workshop here in Nevis. We're bringing together first responders from the fire and rescue, the police, and the medical staff at the Alexandra Hospital. The goal of all of this training is to have a real first responders response with a viable, functional 911 emergency system where all of our responders work in a collaborative effort which would improve the level of care and response given to all of our residents and visitors here on Nevis. It is vitally important because, as we say in trauma, the golden hour is the most important hour, where we can get care to those who need it within that viable hour, and also to increase the survival of life and limb.
Mrs. Roxanne Brooks, in the capacity of coordinator and facilitator for the workshop, gave an overview and introduced her colleagues. We join Mrs. Brooks for this report.
My name is Roxanne Brooks, and I am here in the capacity as the Health and Safety Coordinator with the responsibility for training as part of the Red Cross Well-Prepared Community Initiative. The program that is currently ongoing, we had the first component last year, and the overall objective when this program was launched, it is to bring together the key stakeholders and the key partners in emergency preparedness response at the medical level. So currently on Nevis, our first responders primarily is the hospital and the emergency room staff. This program seeks to bring together, and I would say Chris Flanagan would support that, we have started a great bonding relationship with our other key stakeholders and partners, namely fire and police. So this training is bringing together all three under one umbrella to better prepare and respond to medical emergencies within our community. I will now pass over to Chris Flanagan, who will tell you a little bit more about himself and about his role in the program.
Hello, everyone. My name is Chris Flanagan. I'm from the United States. I serve as the police chief in Radnor Township, Delaware County, and I'm also the EMS chief of Narberth Ambulance, which serves Lower Merion Township. The reason I'm here is to help support everyone who's seated to my left and right to share ideas and give suggestions on how, as Roxanne had stated, we can come together under one umbrella and do the best we can for the community here as a whole and the visitors who come. This is a beautiful country with rich resources and several visitors, and we need to make sure that everybody is as well prepared as possible to save lives, because I think we agree that's the most important thing. So we have taken a tour. We've met with police, fire, EMS, hospital staff, some visitors to Four Seasons Resort, who's vested has a lot of interest and help support our travel here. And what we're going to do is we're going to collect that information. What I would like to share while we have the opportunity is how lucky this country is to have the first responders. The hospital staff's dedication, the fire, the police, and the EMTs and the ambulance operators is phenomenal. Their dedication and pride in what they do and wanting to save lives here in St. Kitts and Nevis is phenomenal. So with that, we celebrate their activities and what they do on a daily basis. We're going to give some suggestions because we've learned by trial and error from where we are. We're going to give some suggestions to help improve it and take a timeline and try and make a timeline short so that people see improvements in response, service level, and training sooner than later. By bringing everybody together, there's also another factor besides just training and skills, and that is a better bond of the emergency service workers. And in this day and age, across the world, we must do a better job. The only way we can do a better job is if we all work together. And that is part of what we're seeing. I think Ann would agree, Roxanne would agree. That's what we're seeing right now is a better bond. Everybody sitting at the same table, even though they have different jobs, and understanding that life preservation is key and you can still do your job, and give them the best training and equipment. It will include some equipment evaluation and talking about the speediest dispatch and response times as possible for all public safety agencies here on both islands. So it is our honor to be here, and thank you for taking the time to listen.
Hello, everyone. My name is Anne Haley-Gurgle, and I'm a paramedic, and I work with Chief Flanagan at Narberth Ambulance in Pennsylvania in the United States. This program is specifically, I was brought in to support Nurse Roxanne for the emergency response program. It is a program that is designed it's a training program that is much more than first aid and CPR. And this training program is available all over the world, and our police and our emergency responders are trained in this particular program. It's been Nurse Roxanne is a certified instructors, and we specifically have been targeting the fire, police, and the hospital staff here in Nevis. And we've had a fantastic positive reaction. They're quick learners. They want to learn. They see the need to learn. And as Chief said, the bond that we've seen with fire and police is incredible. It's an honor to be here. I'm also a homeowner here, so I have a vested interest in the emergency response. We've had a lot of support from the Charity Foundation of the Four Seasons Hotel, and also some of the expats on the island are getting involved. So thank you. Thank you very much.
And that was the Emergency Medical Training Workshop held on Monday, the 10th of February 2020 at the Nevis Disaster Management Department. Senior managers from Ministry of Health and Gender Affairs travelled to St. Kitts to join their counterparts in the annual Pan-American Health Organization PAHO Biennial Work Plan BWP, which took place on Monday the 10th and Tuesday the 11th of February 2020 to launch the implementation of the new BW 2020-2021. The country office hosted a two-day planning meeting with the national counterparts seeking to address achievements and challenges, implementation modalities and shared best practices. The meeting was delivered through a mix of 1, technical cooperation presentations by the PAHO WHO technical advisors and national counterparts, and 2, strategic discussions. The participants included Ministry of Health and Gender Affairs, senior management team, technical focal points, PAHO, WHO management and technical advisors. The two-day meeting also covered the review of 2018-2019 implementation and the end of biennium assessment 2018-2019, the Biennial Work Plan BWP Planning 2020 and Letter of Agreements and Small Financial Contributions training session. Also present at the meeting, the PAHO technical team members included Dr. Yetardis Gibre, PAHO and WHO representative for Barbados and the Eastern Caribbean countries, Dr. Sean Marie Wanga Bowoba, Advisor Health and Surveillance, Disease Prevention and Control, Dr. Darlene O'Meara Taylor, Advisor Family and Community Health, Dr. Karen Paulson, Advisor for Climate Change and Environmental Determinants of Health, Dr. Rufus Ewing, Advisor Health Systems and Services, Dr. Patrice Lawrence Williams, Advisor Non-Communicable Diseases and Mental Health, Miss Donna Lisa Penner, Administrator, and Miss Katarina Smith, Country Programmes Specialists. Premier of Nevis, the Honourable Mark Brantley, Responsible Minister for Health, welcomed to St Kitts and Nevis Dr. Yetardis Gibre, the PAHO WHO representative to Barbados and the Eastern Caribbean, and to discuss the tangible cooperation that is ongoing between St Kitts and Nevis and PAHO and WHO. The STEP programme has been in operation since November 2019. Selected teams of enumerators and clinicians on the island of St Kitts and Nevis have been working throughout the parishes gathering information to assist. We have more on this report from Dr. Retna Walwyn-Brown, one of the supervisors overseeing and supporting the programme.
The 2019 STEP survey fieldwork has resumed in late January 2020. The enumerators are currently visiting households and performing interviews throughout the island. I would like to take the opportunity to encourage every division to participate, as this is an opportunity to get free health checks and to contribute to data collection, which will guide and assist the Ministry of Health in its fight against NCDs.
In part two, Dr. Nisbet and Nurse Scarborough give an update, read the coronavirus. We followed this story after the break.
Coronaviruses, COVID, are a large family of viruses that cause illness ranging from the common cold to more severe diseases such as Middle East Respiratory Syndrome MERS-CoV and severe acute respiratory syndrome SARS-CoV. To protect yourself and prevent the spread of the infection, practice regular hand washing, covering mouth and nose when coughing and sneezing, thoroughly cooking meat and eggs. Avoid close contact with anyone showing symptoms of respiratory illness such as coughing and sneezing. This message was brought to you by the Nevis Health Promotion Unit.
Welcome back. Coronavirus has been dominating all news channels globally, and although coronavirus has not reached our shores, we all have a responsibility to be vigilant, and we owe it to ourselves to become more aware. The Health Promotion Unit Health Matters Programme host Ms. Chevenay Nisbet met with Dr. Judy Nisbet, Medical Officer of Health in Nevis, and Nurse Ms. Jessica Scarborough, Deputy Matron and Infection Control Coordinator at the Alexandra Hospital. We join Chevenay Nisbet for this report.
Okay, so it has to be someone who would get this disease or the virus from an animal. Is they eating it as opposed to it biting or scratching them, or
most likely eating, or just the secretions from the animal, reaching their mucous membranes. For example, in MERS, I don't think they eat camels. I'm not sure.
Right.
Right. So it most likely will be the secretions from the camel's nostrils and close contact with the camels and so forth. Okay. So how it's spread, it could be from anyway, just handling them and then handling yourself or eating.
Yeah.
So we're not certain.
Okay.
Really.
And how does one protect themselves from contracting the virus?
No, there are no vaccines at this point in time to prevent the corona infection. So the best way is to practice infection control.
Right.
And that would include our recommendations are to use preventative measures to help the spread of to help prevent the spread of respiratory viruses.
Right.
Now, these could include hand washing, and we are very stringent with hand washing because it really works, especially to combat and to prevent, lessen the spread of germs. Now, yes, you may say that we do wash our hands, but a lot of us don't wash our hands properly either. I usually tell persons that you're supposed to be washing your hands for at least 20 seconds or for as long as the happy birthday song. I think everybody knows the happy birthday song. Yes.
And that concludes this week's edition of On the Healthline News Reviews and Updates. Thank you for joining. Until the next time, I'm Sheila James, your presenter. Goodbye. On the Healthline Nevis News and Reviews Roundup, brought to you courtesy of the Health Promotion Unit in association with Evelyn's Drugstore.